Welcome, everyone. Bienvenidos. Thank you for joining us for this virtual UHealth International Medical Series presentation featuring distinguished ophthalmologists from Bascom Palmer Eye Institute. Our topic tonight is Technological Innovations in Ophthalmology. I'm health journalist Ileana Bravo, and I'll be your moderator for the evening. As we are offering simultaneous interpretations, allow me a moment to address our Spanish-speaking colleagues. El día de hoy estaremos ofreciendo interpretación simultánea para la audiencia de habla hispana. Por favor, sigan las siguientes instrucciones para poder cambiar el audio a español. Localice el botón que se encuentra en la parte de abajo derecha de su pantalla de Zoom que dice Interpretation. En ese botón hay un dibujo de un globo. Pulse el botón y seleccione el idioma español. Una vez seleccionado, usted podrá escuchar la presentación en su totalidad en español. Si desea cambiar de idioma durante la presentación, puede hacerlo usando ese mismo botón. Okay, so let's get on now. Good evening to all of you and to our stellar Bascom Palmer ophthalmologists. We are delighted to announce that Bascom Palmer Eye Institute once again has been rated the #1 eye hospital in the United States. And tonight, you're going to learn more about why they've earned that distinction for the past 19 years. Bascom Palmer experts are ready to care for your patients in one of our 5 Florida facilities for second opinion consultations or via telemedicine from the comfort of their home. To refer a patient, we invite you right now to read the screen to contact UHealth International at 305-243-9100. By email at uhealthinternational@med.miami.edu or by visiting uhealthinternational.com. Tonight, you're going to hear from 3 Bascom Palmer ophthalmologists who will share emerging ophthalmological technologies and how they can be used to help you provide the very best eye care for your patients. So here's our lineup on your screen. Dr. Rania Habash, who will discuss technological innovation at Bascom Palmer Eye Institute. Dr. Florence Cabot, who will address a revolutionary drone slit lamp. And Dr. Alfonso Sabater, who will present innovations in eye banking. During the presentation, we are going to poll the audience on topics relevant to our discussion, so we invite you and encourage you to participate. Your answers are anonymous, but please participate in answering our poll questions. Also, throughout the presentation, you have the opportunity to ask our panelists anonymous questions using the Q&A feature at the bottom of your Zoom screen. Let's locate that now too. It's to the left of the interpretation button. It has 2 little dialog boxes. So you can do questions throughout the presentations, and we will present them to our experts at the end of the presentation. So with that in mind, I'm pleased to introduce Dr. Rania Habash, an assistant professor of clinical ophthalmology and Bascom Palmer's medical director of technology innovation. Deeply involved in the information technology aspect of medicine, Dr. Habash works to help patients through technology. She instituted Bascom Palmer's successful telemedicine program at the start of the COVID-19 pandemic. And she leads Bascom Palmer's partnership with Microsoft's Global Artificial Intelligence Project to develop a worldwide screening and assessment system to improve diagnosis of serious eye problems using patient records from Bascom Palmer and from other sites around the world. Please welcome Dr. Habash.
Hi, everybody. I'm honored to be here. Thank you so much, everyone, for putting this together. I think this is going to be an excellent program for all our international and domestic colleagues out here. So I hope you'll all enjoy this talk. It's kind of highlighting the technological innovations that are occurring at Bascom Palmer. There are a lot of them, so I just chose a few really big ones to focus on. But keep in mind, there are a lot more and more to come in other series. So without further ado, let's get started. Right now, we are in a Renaissance age in medicine. So, the pandemic can either be looked at as transformational or it can be tragic. And it is tragic in a lot of cases, but it's also very transformational. And we've seen a really big incline in technological development since that time. So with crisis comes opportunity. And the reason I put this slide up here is because this is supposed to be Newton sitting under the apple tree. When he was in quarantine for the bubonic plague is when he came up with his 3 laws of physics. So, again, using this kind of time is a great opportunity to spur medicine forward. And that's what we're going to be going through today. Okay, so I guess the first place to start is telemedicine, because that's really been the savior for everyone during the pandemic to help us keep our patients seen. But this is our playbook at Bascom Palmer. We found some really interesting ways to do telemedicine. I won't be able to go through all of these right now, but if anyone wants further information, you can always reach out to me. But some of the most successful visits we've seen are virtual urgent care visits, which is when we basically triage patients. Do you need to come in or not? That's very, very important for a patient. New follow-up and post-op patients, virtual counseling, second opinion consults, doctor-to-doctor consults, and those we'll get into here in just a second because they do involve our domestic and international colleagues as well. Drive-through IOP checks, resident ER telestaffing, remote home monitoring, and online communications. So, a couple of things that have been really successful for us are doctor-to-doctor consults and second opinion consults. And these are both international and domestic. And I wanted to highlight this because this is the service that we'd be able to offer anyone. There are so many times when we need help from our colleagues. I need help all the time from some of my colleagues here at Bascom Palmer. And, some of these physicians are subspecialists in fields, and it's so nice to be able to reach out to them for a helping hand for a patient. And we get to keep our own patients as well, but still have that subspecialty care at our fingertips. And this is a perfect example of that. So this is me doing a telemedicine consult with Dr. Flynn and a physician from another country and with patients. So we have a 4-way doctor-to-doctor consult and second opinion consult sort of combined here. The patient was very, very happy. The physician was very happy to have the Bascom Palmer care from Dr. Flynn. And, this is one of those situations where we can really just serve a great purpose. This is kind of the new age in medicine where we can be collaborative and we can all work together for the good of the patient. And virtual counseling, if you look over here, has been very successful as well. This is when you can just counsel a patient about anything. And I think that the best use cases for these are premium IOL talks, refractive lens talks, uveitis, ocular oncology. Those are all really kind of discussion intensive fields. And so we are very successful in doing these virtual counseling visits where we can talk to a patient in the comfort of their own home with their family around. The families can ask questions. Again, this is the new generation of medicine where we're being collaborative here and inviting the whole family and also being very successful at it because the patients are more relaxed, we're more relaxed. And I'll tell you a comment that I've been hearing, which is patients actually think this is more personal for them than a regular visit because, they're getting more face time actually, and you're not, focusing on just filling out your charts or getting a phone call or running from room to room. You're actually just sitting there talking to them, looking them in the face with their family there. So you learn a lot about your patient, they learn a lot about you, and I think it's a very relaxed, very successful visit. Okay. I'll show this very quickly because this is to highlight our slit lamp that's a video slit lamp. Now, Dr. Cabot is going to talk about the drone slit lamp, which is even more sophisticated, but this is a very simple example of a Channel 10 news interview that we did. Okay.
Focusing on you, innovations in modern medicine from your team of eye experts at Bascom Palmer Eye Institute.
I can see that very well there.
A new age in eye care has arrived at Bascom Palmer Eye Institute, the nation's #1 eye hospital. Now, doctors are treating patients through a combination of virtual and in-person visits.
This is super advanced, creative telemedicine. It allows Bascom Palmer specialists to help patients from anywhere in the world
Dr. Rania Habash is part of the medical team for 12-year-old Chloe Shapiro. After performing her recent eye surgery, Dr. Habash remotely observed Chloe's clinic checkup by using a video slit lamp.
So it snaps into place just on a smartphone. You start the Zoom call, you do a screen share, and the person on the other end can watch the entire exam.
In just one sitting, Chloe consulted with 2 of her doctors.
That's why I also like this whole telehealth, like the online appointments, because it's very useful in that sense. Like in 3 hours, I got 2 appointments done.
Patients like Chloe can also use Bascom Palmer's virtual urgent care and second opinion virtual consults, all without leaving the comfort of their own homes.
Telemedicine has been super useful for us during difficult times like this. It's also an opportunity for us to grow the practice of medicine in a more evolved way. So I'm really proud of Bascom Palmer for that.
Focusing on
To grow the practice of medicine in a more evolved way. I think that's the take home that I want to relay here. All right, so in terms of medical innovation, there are several things out on the horizon now that we're doing, but I wanted to highlight just a couple of these. So ocular surface cancer treatment, Dr. Karp is leading the way for this. And you know, this used to involve surgery and a lot more time, but she's using 5-fluorouracil now. So after just a few cycles of 5-FU, you can see the difference between these 2 eyes, right? For ocular surface cancer treatment. So very, very sophisticated, or very, surprising results here. And then for ROP treatment, I know when I trained as a resident, we were doing laser, and now things have changed quite a bit. So we're using avastin to treat these babies, and not getting nearly as much scar tissue or traction as the laser can cause. So again, very important medical innovation. And then photodynamic therapy, Dr. Guillermo Mascua is leading the way with this. And here you can see a perfect example of a patient with a corneal ulcer being treated with PDT, and just an amazing result at the end of this. So topical medications now, and treatments instead of surgical. And then in terms of surgical innovation, we have things like gene therapy, 3D printing, 3D surgery, bionic eyes, premium cataract surgery, and laser refractive surgeries. And I can't really touch on all of these, but I'm going to highlight a couple of really important ones here. So gene therapy, and Dr. Adina Barakal is leading the way for this. We've been doing, or she's been doing, gene therapy for kids with Leber's congenital amaurosis, and has had a lot of success with this. So this basically involves just injecting a healthy copy of a gene into the retina. It's usually OCT guided to do so. And that healthy gene then just starts replacing the damaged genes. And little by little, the cell just makes those normal proteins, so the normal proteins of the cell, using that healthy gene rather than the damaged one. So all of a sudden, you're pumping out normal healthy copies of this gene where they were just damaged before. And there are other kinds of conditions that we can use for this. This is one of Dr. Barakal's patients. His name is Creed. Creed has LCA, or Leber's congenital amaurosis, and it's very sad. He used to have to carry around a flashlight all the time, even in his lunchbox, just to see what he was eating at school. And over time, had she not treated him, there wouldn't be a light that was strong enough to help him. And this is the real difference in what she's been doing. Creed has not carried a flashlight since his treatment with Dr. Barakal. It's really amazing. So he also said, I can see a rainbow for the first time, which I thought was really great. Now, what are some of the other conditions that we can treat with gene therapy? I mean, things with mitochondrial, gene issues, and that's like Parkinson's disease, certain cancers, the aging phenomenon, and then most recently, COVID-19. This is one of the treatments for COVID-19 as well. And Dr. David C. has been very successful in doing 3D printed eyes. Now, this is very important because before, the way these prosthetics were created, they didn't fit well, they weren't comfortable for the patient, they weren't very cosmetically appealing. But this is incredible because all they do here is scan the other side of the face, the healthy side of the face, and then make a mirror image of it and then mesh the two, which creates a 3D image. And after that 3D image, it's uploaded into a 3D scanner or 3D printer, which prints out the prosthesis from nanoparticles. And now you have this perfectly fitting prosthesis instead. But the really amazing thing about it is that it just takes hours instead of weeks and weeks like it did before. And it's just a digital file. So imagine if someone in India wants to send, Dr. C a picture of their patient, you can use the picture to create this prosthesis from afar. So it's all digital now. And then of course the cost is much less because we're doing it this way. So faster, better, cheaper, and again, the more evolved way to practice medicine. Software technology obviously has really taken off, even before the pandemic, but now, especially afterwards, we're finding more and more of a reason or need for it. And this is Satya Nadella, the CEO of Microsoft, who says artificial intelligence represents one of technology's most important priorities, and healthcare is perhaps AI's most urgent application. So I'm a big fan of this because a couple of years ago, we started working with Microsoft to mine our own data from Bascom Palmer and collaborate with other institutions. But we ended up using about 86,000 images to train a machine to recognize 5 different diseases, or 4 different diseases actually, plus a normal. So macular degeneration, glaucoma, diabetic retinopathy, and ocular melanoma. So this is the first multi-disease retinal algorithm out there. And that's really exciting because if you think about the practical application for this, imagine a patient going to CVS or Walgreens or something like that, having a non-mydriatic photo of the fundus and then an autonomous read. And I'm sure a lot of people have seen in the news lately that we now have a code for autonomous reads, and there was another AI company, iNook, that was just approved for by the FDA. So this is a field that's really taking off, and I think that multi-disease imaging is really where it's at. Now, I added these to the list because these are our next diseases that we want to tackle. We want to do retinopathy of prematurity screening. Just imagine, in places that don't have a pediatric ophthalmologist who is used to doing this, you can just take a picture of this preemies eye and be able to get a diagnosis autonomously and refer them appropriately and expeditiously if they do have disease. So, this is taking a patient from blind for the rest of his life or her life to seeing again. And that's the real power behind AI here. Childhood myopia and then Alzheimer's disease are also things that we can tackle this way and are on the list to follow. The next stage of this is combining our data with everyone else's. So we have started the Bascom Palmer Collaborative Network for data sharing. What this means is, we can all pool our data, because the more data we have, the better and stronger our algorithm will be in diagnosing these different diseases. And so, if we can all work together, we're just working again to evolve medicine forward, which is what I love. And I wanted to highlight Dr. Mohammed Abushusha, another one of my colleagues, who is doing a very interesting algorithm for diagnosis and therapy for different types of retinal diseases, or different types of diseases in general, actually. His algorithm works on a wearable headset like the Microsoft HoloLens or the Magic Leap goggles, and serves 2 purposes. One is to use an algorithm for diagnostics, things like visual field testing, right? And then the other is to do therapeutics. And so if a patient has lost vision from a certain disease, he's able to fill in the diseased areas by using this algorithm. And here's what it looks like. So if you look here, these are pictures of what he's doing. A patient with glaucoma, this is normal vision, but in a patient with glaucoma, this is what they would see instead. But with the augmented vision, with the artificial intelligence algorithm filling in the missing blanks, this is what the patient sees instead. And so on and so forth with stroke, double vision, macular degeneration, with central defects and distortion. And I wanted to show, this is a little bit enlarged version here, but I like this picture because it really says a lot. I mean, this is a patient with normal vision, okay? You can see the taxi here and you see the people on the sidewalk. Here's a patient with a stroke. So this is like a hemianopsia. And there's no car seen in this view. So imagine if this patient were trying to cross the street they can't see that car. But with Dr. Abushusha's augmented vision, you can see that he is now seeing the car. You know, the algorithm fills in those blanks for his retina and his brain, which is unbelievable. So, you know, these are the types of innovations that we have now, currently at Bascom Palmer, and that will be a little bit more mainstream to come. There's a lot more to come as well. You can see here all the different types of labs that we have. Each one is running the show again to the main point here is to evolve medicine forward. So I'm really proud of Bascom Palmer for everything that we're doing. You know, we love technology here. So welcome to the future of technology at Bascom Palmer and beyond. Thank you.
Thank you, Dr. Habash. And that leads us to our very first poll question of the evening, of which we'd love for you to comment on that. And that is, will artificial intelligence replace doctors? Yes or no? I'm curious to see what the response will be on this.
Me too.
Please respond if you think that artificial intelligence will replace doctors. Yes or no? Sí or no?
Ileana, I'd love to know your response as well.
Gosh, I hope not. The personal touch is everything. I really don't, I really hope robots don't start treating us. It's okay for the robotic assisted surgery, but we still need human interaction. Oh, there you go. What do you think?
Yes. So I totally agree with these results. We may discuss them a little bit further, but yeah, my 2 cents is, you know, this is kind of like, you know, driving through the city using Waze or Google Maps or whatever. You know, it's an augmentation to what we're already doing, right? So we're the ones who have to carry that weight and see the patients and make these bigger decisions, but AI can certainly augment us, and it kind of gives us superpowers to do so.
Yeah.
So I agree with the crowd.
Good. Just like the self-driving cars, we're not even there yet. So.
Exactly.
Thank you so much, Dr. Habash. That was great. So obviously, you'll stick around for all the questions that we're going to get from our audience. And now we move on to our next presenter, Dr. Florence Cabot, an assistant professor of clinical ophthalmology. A specialist on cornea, cataract, and refractive surgery, Dr. Cabot is an active researcher at Bascom Palmer's Ophthalmic Biophysics Center, where more than 350 surgical instruments and clinical devices have been developed to improve patient care. Last year, Dr. Cabot was selected as the emerging vision scientist in the state of Florida and was invited to our nation's capital to advocate for vision research. Tonight, she's going to speak to you about the exciting development of a remote-controlled drone slit lamp to facilitate eye care telemedicine during emergencies, such as COVID-19 pandemic, and in underserved areas, of course. Please join me in welcoming Dr. Cabot.
Thank you, Ileana, for this nice introduction. I'm very excited to be here and to talk about this new technology created here at Bascom Palmer Eye Institute, the drone slit lamp. I have no financial disclosure, but we did apply for a patent last year. This project was initially supported by the Department of Defense in 2009, 2013, then by the Grant Changes Canada grant, in addition to the core grant supporting Bascom Palmer Eye Institute and the Ophthalmic Biophysics Center. So everything started at the Ophthalmic Biophysics Center, directed by Dr. Parel, that you can see here on the picture, with a big team of engineers led mainly for this project by Alex Gonzalez and Cornelis Rowan. It took us 10 years, so over a decade, to bring this machine from the lab. You can see a picture from the first device, the first generation in 2010, and here in 2016, you can see the evolution over the years, improvements in the software, in the hardwares, and finally, a few months ago, we were able to bring the third generation to the clinic here at Bascom Palmer Eye Institute. So the principle is very simple. In one room, we can call it the exam room, you're gonna have the robotized slit lamp with the patient seated next to, in front of the slit lamp robot or robotized slit lamp. In a different location that can be on a different building, a different floor of the same building, can be a different city, a different country, and different continent. You can have the doctor actually operating and controlling these robotized slit lamp. How do we do that? The doctor just need an internet connection, whether it's Wi-Fi, 4G, 2 applications. So TeamViewer, which is the interface we use to control the slit lamp, password protected, of course. And we usually use Skype to be able to talk to the patient. We can log in through a desktop, a tablet, a cell phone, a laptop. It doesn't matter as far as you have the internet connection and the 2 applications. What are the capabilities of this device? So for now, we can provide a full anterior segment exam. And in a few slides, I will show you a demo video, and I will go into details about all the features and parameters you can adjust with this device. For now, we are not able to measure the visual acuity, measure the ocular pressure, or perform the fundus exam. One thing mentioned already by Dr. Habash, we need to make the distinction, the difference between these drone slit lamp and the digital slit lamp cameras. The digital slit lamp cameras are just an add-on module mounted on conventional slit lamps, and they require a certified operator, a certified technician, a resident, a fellow, a doctor actually moving and controlling the slit lamp on site with the patient. So in the exam room, you have the patient plus somebody else who knows how to control a slit lamp. And those exam videos, photos can be then transmitted through internet. So very different than our technology. So I'm gonna go here in this video. It's a 7-minute video. I'm gonna go into details about all the features you can adjust with our drone slit lamp. You gonna see how I perform the exam live with our healthy volunteer, and you can see here, this is the interface when I log in into the TeamViewer. That is the interface I'm gonna see on my computer. You can see 2 images with the eye at the top, right and left screens. And it's, if you want to have a 3D vision, if you have a depth of field, a depth of perception, you can use prism glasses, and those 2 images are going to fuse in just one. So if you want to assess, for example, the cells in the anterior chamber, you can put the prism glasses and have a fusion of these 2 images and see those cells. As a cornea specialist, I'm more focused on the cornea, and I usually take a look in 2D. So I'm just focusing on the left screen and not using the glasses here for this demonstration. At the bottom, you can see another screen where I see the head of the patient. So it's an overhead camera that allows me to be sure that the patient is well positioned. I can zoom in and zoom out to see if everything is okay with the patient. Through Skype, I can talk to the patient. I'm not doing it right now so that there's no echoes, but I could tell the patient, hey, push your forehead forward because I can see you're not well positioned. Currently, you see the slit lamp is focused on the left eye. If I want to start the exam with the right eye, I'm just going to click on the eye window OD, and you're going to see automatically on the bottom screen that the slit lamp is moving towards the right eye of the patient. So I'm currently in my office. The drone slit lamp and Melissa are on the 3rd floor in Bascom Palmer. I could be at home in my bed. I could be in Japan. I could be in France. That would be exactly the same thing if I have the internet connection, the TeamViewer and the password. I will be able to operate this slit lamp myself with the computer. There is one fixation target, and we can turn it off or turn it on. And then as a regular slit lamp, I'm going to use some buttons to go towards the right side, to move the slit lamp towards the right side, towards the left side. Here you can see the slit lamp moving. I can adjust the Z-axis here. Okay, and if I use the top arrow and the bottom arrow, I'm going to change the focus. So you can see here, I can see perfectly the details of the anterior capsule and the crystalline lens. If I move a little bit backward the focus, then I'm going to see I'm being focused on the cornea. If I switch now to the left side, you can see all the parameters you can actually adjust with the regular slit lamp. So first, the optical magnification. So currently I'm at 10x. I can go 6x, 16. And every time, of course, I change the magnification, I need to readjust the X, Y, and Z axis. Here, I change the focus, readjust to right and left. All right, so I'm focused in the cornea. I can go even further, 25. I can change the focus if I want to look, for example, at the lens. So now I'm focused on the lens. You can see the anterior capsule. If I push a little bit more, you can see the cortex of the crystalline lens. I go back to the cornea. So I have a nice cross-section of the cornea here, and I even can go further to 40x. If the patient had a DZEC and want to look at the interface, I can have a perfect cross-section and image of the cornea. So every time I change the magnification, I need to readjust the focus exactly like I would do with the regular slit lamp. I can change the filters. I can change the height of the beam. I can change the width, for example. If I go back here, I'm not going to do it because it's very bright. I can also change the intensity of the light and the angle of the slit lamp. So if I click here on plus 60, you're going to see the slit lamp is going to go all the way to the side. If I want the slit lamp to go on the other side, still imaging the right eye, I'm going to click, for example, on minus 60, and you see the slit lamp moving all the way to the other side of the right eye. So you have for the light intensity, the angle, and the width, some preset values. You can see here, for example, 60, 45, 0. If I want to go in between 45 and 60, then I'm going to adjust with the slider. So the slider is kind of a fine-tuning in between the preset values. Another interesting feature we added on the system is the capture. So the ability to take a picture. If I click here, up, so I'm going to have a screenshot of the screen. And I can easily, if I click here on Files, Extras, and Open File Transfer, in a few seconds, I'm going to transfer the screenshot from the Journal slit lamp computer to my own computer. But remember, it's not stored in a U-chart, so it can be transferred to your own computer, but not to U-chart yet. Another feature we added here is you can see the green line here on the left side, and I can draw another one here. So it's some calipers, and this green line can allow me to measure something. So if I want to measure the diameter of the cornea, for example, I'm going to do this, and automatically I'm going to have the measurement displayed here, 12 millimeter. If I click on Capture Now, it's going to take the screenshot with the green line and with the measurement. So this feature is extremely interesting to follow, for example, a KED or a cornea ulcer and measure the size of the KED or the ulcers over time. Another feature we added is here, if I click on this magnifier, I can have an extension of the magnification with a digital zoom. So in addition to the regular optical magnification we went over earlier, you can also have this digital zoom. You're just losing, like a regular camera, losing in resolution when you do that. So these are the main features we can have with this robotized slit lamp. So you can All right, so now a few words about where did we use this system. So the first generations of slit lamps were actually shipped to India, and it's Dr. Mukesh Taneja, who is a former Bascom Palmer Institute alumnus. He was a research fellow here at the Ophthalmic Biophysics Center a few years ago. He's now in LV Prasad Eye Institute in Hyderabad, and we shipped 9 units in India that were shipped to remote areas, underserved areas, and Dr. Taneja was able to do a remote eye exam and provide eye care to underserved population. Another unit was also shipped in Canada, and is Dr. Martin ten Hove, who is also a Bascom Palmer Eye Institute alumnus, who is now in Kingston, Ontario, Canada, working at the Queen's University at the Hotel Dieu Hospital, who's been developing this project in Canada. And he shipped one of the drone slit lamp in a very remote area on a tiny, tiny island called Moose Factory, where there's no eye specialist. And so he's been using this device to provide eye care in this, again, underserved population. And finally, in Bascom Palmer Institute, we are actually the only site in the United States being able to use this technology. One thing to understand very clearly, this is a research instrument, so it's not commercially available yet. It's under a study protocol, and each patient being imaged with this system needs to sign a consent form. What are the applications for this system? Of course, we saw it in India and Canada, underserved areas, whether it's in the developing countries or even the US, for example, in the Midwest, where there's a lack of ophthalmologists, these devices would be very helpful. In the military as well, there's a lack of ophthalmologists in the battlefield. We could ship those slit lamps to provide remote eye exam for the soldiers. In prisons to examine the prisoners as well. And of course, I think the main example is also the viral pandemic we went through a few months ago, the COVID-19. That was the first experience we had with this device. And just to give you an example, in our emergency room here in Bascom Palmer Institute, when a patient checks in, he's going to see at least 3 to 4 people, 1 technician, 1 resident, 1 ER attending or fellow supervising the resident, and potentially, if it's a complex case, 1 subspecialist. So you have the risk to be exposed, a risk of transmission to 3 to 4 people. If we use our system, it's basically 1 patient being exposed or exposing just 1 individual, literally the person bringing the patient into the room, and that's it, because all the doctors, whether it's resident, an attending, or a fellow, can do the remote anterior segment exam in a different room. So with this system, we can at least divide by 3 the number of people exposed in a case of a viral pandemic. So in conclusion, I think the system we created here is unique. Of course, there's the new steps to take and the new features we can implement. And why not in the future thinking about implementing an artificial intelligence software and develop a new generation of slit lamps powered by computers. I would like to thank the Ophthalmic Biophysics Center team, our collaborators in India and Canada, Dr. Alfonso for his support since day 1, the emergency room team in Bascom Palmer, Dr. Yu, the photography department, and the Bascom Palmer Eye Institute administrative and international team for their kind invitation. And thank you all for your attention.
Thank you, Dr. Cabot. And this poll question is specifically about the current capabilities of the drone slit lamp. So on your screen, you're going to see the little buttons to the left of the multiple choice responses. What are the current capabilities of the drone slit lamp? You are to click on the button, IOP measurements, fundus exam, anterior segment exam, visual acuity testing, or all of the above. And Dr. Cabot, I think that it was important for you to point out that this device is not commercially available. I'm certain that those in the audience tonight are very interested and have a million questions about it. So
exactly, yeah. This is something I wanted to mention because every time I, talk about this device, the first question is, where can I buy it? How much is it? So this is a research instrument for now, and we've been collaborating with Canada and India, with the first generations to see if it was working, to calibrate it, but hopefully in the future, I hope this technology can be available for everybody. So it's a process, so it's going to take time, but we will get there.
Do you see the screen, Dr. Cabot, to see the responses? So 73%.
With the right answer. Perfect.
Well, of course, you're talking to medical professionals and colleagues.
Yeah.
Thank you so much, and fascinating presentation. And I invite you and remind all of you in the audience again that your Q&A feature at the bottom of your Zoom screen to the left of the interpretation little globe, that's where you can submit questions for our panelists. You have the ability to speak directly with them tonight, and they will answer as many questions as possible as you enter them. So our final speaker is Dr. Alfonso Sabater, an assistant professor of clinical ophthalmology. Dr. Sabater is a cornea and cataract specialist. His areas of expertise include ocular surface disorders, corneal transplants, and cataract surgery. His research focuses on stem cell therapy applications for corneal regeneration, ocular surface reconstruction, and translational biological therapies for corneal and ocular surface diseases. In conjunction with the Florida Lions Eye Bank, Dr. Sabater has developed different therapies and medical devices to protect and regenerate the cornea. Please welcome Dr. Sabater. He should be with us any second now. Do we have any issues with Dr. Sabater? Dr. Cabot, I think you need to stop your screen from sharing so that he can jump on. And that should resolve it, we hope.
Yes, that's perfect.
Hi there.
Thank you. All right. Can you see my slides now?
Yes, we can.
Perfect. All right. Well, good evening, and thank you, Ilana, for the introduction. So today I'd like to share with you some of the most relevant innovations in eye banking that we are developing at Bascom Palmer and in collaboration with the Florida Lions Eye Bank. So in first place, for those of you who are not familiar with eye banks, they're usually non-profit organizations that obtain, evaluate, and distribute donated eye tissue, and most frequently corneas. Actually, corneal transplantation is the most frequently performed type of transplant worldwide, as corneal blindness is actually one of the main leading causes of blindness in the world. There are multiple causes of corneal transplantation, but the most frequent ones are corneal endothelial dystrophies, such as Fuchs dystrophy or bullous keratopathy, which are conditions that affect the inner layer of the cornea and cause the cornea to swell. Also, keratoconus, corneal infections, traumatic injuries, or previous eye surgeries are common causes of corneal transplantation. Actually, almost 200,000 transplants are performed worldwide every year. In particular, at Bascom Palmer, we perform more than 250 corneal transplants annually. However, as we can see here in the map, most of the countries in the world need to import tissue, and it is estimated that only 1 in 70 of the needs of corneal transplantation are actually covered. And we know that this is a problem that is going to get even worse as the population is aging in almost every country. Actually, one of the most frequent causes of corneal transplantation, which are corneal endothelial diseases, are more frequent in the elder population. So in collaboration with the Florida Lions Eye Bank, and of course, supported by Bascom Palmer Eye Institute and the Beauty of Sight Foundation, we decided to focus our research on 3 very specific goals in order to alleviate the demand for corneal tissue. So number 1, we want to enhance the quality of stored corneal tissue so we can make the corneas last longer after transplantation. Number two, we want to generate an unlimited supply of corneal tissue so we can reduce or even eliminate the waiting list for corneal transplantation. And number three, we want to improve the success of corneal transplant surgery so we can obtain better clinical outcomes and also reduce the risk of primary graft failures. So let's start talking about goal number one, which is to enhance the quality of stored corneal tissue. So here in the United States and actually in many parts of the world, corneal tissue is usually stored in a cold preservation media, and we know that many of the cells that keep the cornea transparent, which are the endothelial cells that I mentioned before, to suffer significantly during storage, and many of them die. As you can see here in this figure, all of these brown dots that we can see in the picture are actually apoptotic endothelial cells that are dying in these stored corneas. So interestingly, we know that endothelial cells do not regenerate. So once they're damaged, they're damaged. And we know that endothelial cell density keeps even dropping more after corneal transplantation, which means that the higher number of endothelial cells that a donor cornea has, at the end, it's better for the patient. So ideally, corneal preservation vials should maintain each corneal layer, and especially the corneal endothelium, in optimum conditions. Unfortunately, even though the cornea has two different surface layers, the epithelium and the endothelium, our current storage vials allow the corneal graft tissue to be preserved only in one single media that passes the entire cornea. But we know that when a cell dies, it also releases some factors that can negatively affect the surrounding cells. So for this reason, we developed a new corneal tissue preservation vial that we call the dual chamber vial that actually allows to preserve the corneal tissue, isolating the epithelial from the endothelial corneal layers. But it also allows to use two different preservation media at the same time. So as you can see in the video, the dual chamber vial has three components. So number one, we have a cup, then we have a fixation ring, and finally we have the bottom chamber. So the way this chamber works is, number one, we fill this chamber with a preservation media that will be only in touch with the corneal epithelium, which is the surface of the cornea. Number two, the corneal tissue is placed on top of this bottom chamber. Then number three, the fixation ring locks the corneal tissue in place without actually touching the cornea. It just touches the sclera, the white part of the eye, that won't be transplanted. And as you can see in the video, the cornea will act as a barrier between the upper and lower chambers. And number four, the upper chamber is filled with a preservation media that will be only in touch with the corneal endothelium and could be the same or a different media than the one we're using on the bottom chamber. And finally, the dual chamber is secure with the cup. So interestingly, according to our preliminary results, we have seen that corneal endothelial cell viability is actually superior in corneas that have been stored for 2 weeks in this dual chamber vial versus corneas that were stored in the regular single medium vials. But not only that, we have also observed that in contrast to what happens with the current vials, where corneal thickness increases progressively during preservation due to the stromal swelling, the corneas that were actually stored in the dual chamber maintain the same original thickness after 2 weeks of storage. Our preliminary data, very interestingly, also show that the levels of cell death in the epithelial layer using the dual chamber remain similar between the single and dual chambers. But in contrast, the endothelial cell levels were significantly lower when the corneas were preserved in this dual chamber vial. So these are just preliminary data, and we are currently analyzing more and more cases, but hopefully this new dual chamber will enhance the quality of the tissue and also improve the clinical outcomes of corneal transplantation. So now let's move to goal number 2, which was to generate an unlimited supply of corneal tissue. So since a few years ago, corneal endothelial transplantation has become the most frequent type of corneal transplant in the United States. Actually, since 2011, here in the United States, endothelial transplants are the most common type. Nowadays, we have mainly two different techniques available called DSEC and DMEC. And in particular, we're focusing on generating DMEC graft substitutes. Specifically in this type of corneal transplant, which is indicated in patients that have corneal endothelial dysfunction, only the endothelial layer is removed from the patient, and then a very thin endothelial graft isolated from a donor is inserted into the eye and folded and attached to the posterior cornea using an air bubble. So as this is the most frequent type of corneal transplant in the US and also in many parts of the world, we decided to focus on generating multiple corneal endothelial grafts from each donor using tissue engineering techniques in order to alleviate this corneal tissue demand. So this is the way we're doing it. So number one, we retrieve corneal tissue from human donors. Then we isolate the corneal endothelial cells from the graft. And then we expand these cells in the lab in different wells until these cells are confluent and ready to be transplanted. So a couple of years ago, we partnered with a German company called TissueGuard to develop a special type of culture plates that allow us to detach the endothelial cell layers from the plates, forming a compact endothelial tissue graft that could be transplanted into the eye following our standard surgical procedure. So the way these new plates work is by introducing an enzyme in the system that actually cuts the attachment between the cells and the bottom of the plates, but allowing the cells to preserve the extracellular matrix that they produce. And this results in endothelial grafts that have their own pseudo-Descemet's membrane without the need of any external components. So here in the following video, you can see an example of how we generate these tissue engineered endothelial grafts. Number one, we do the expansion in the lab of human corneal endothelial cells. And once we have the desired cell density, we introduce an enzyme that cuts the connections between the extracellular matrix produced by the cells and the culture plates. This way, the endothelial cells can detach from the plates, generating an endothelial graft that, as you can see, can be manipulated. And also, we can actually stain these grafts as we do with the tissue endothelial grafts nowadays in surgery. And once we have a tissue roll, it can also be loaded into a cartridge that will be later used to insert the tissue into the eye. We're planning to start the first animal experiments in the next couple of months to confirm the efficacy of this new technique. But in the meantime, we have confirmed in an artificial chamber, as you can see here in the video, that actually these grafts could be inserted into the eye and also manipulated and unfold and attach to the posterior part of the cornea, exactly as we do with regular corneal transplants. In addition to that, we are also currently manufacturing a new endothelial graft tissue injector, as well as a new transportation chamber that will allow us to deliver and transplant the tissue safely from the eye banks into the eye. And finally, I'd like to share with you our third innovation, which is how to improve the success of corneal transplant surgery. So we know that the cells usually have growth factor receptors on the surface of their membranes that once become stimulated by a specific growth factor molecules, they can transmit a signal inside the cell and activate specific genes and induce cell proliferation and therefore tissue regeneration. In particular, we know that blood platelets are a huge biological reservoir of growth factors, and they're actually very easy to obtain. So we decided to evaluate the effect of the platelets growth factors on corneal endothelial cells. And this is how we're doing it. First, we centrifuge the blood of the corneal transplant recipient, and then we separate the plasma and activate the platelets with calcium to induce the release of these growth factors into the media. Once the plasma is activated, we just put it in a little oven at 37 degrees and for about 30-45 minutes, so the platelets can release all their growth factors into the media. So then the the way we would do it is we would briefly incubate the corneal tissue that we're going to transplant into the patient in this plasma solution that is rich in growth factors in order to stimulate the regeneration of the corneal endothelial cells. But first, as this procedure will be done right during surgery, before transplanting the cornea into the patient, we needed to know actually how much time do the growth factors require to join the receptors and activate the regeneration pathways. And interestingly, we observed that just 15 minutes of incubation was enough to activate the AKT pathway, which is one of the most relevant survival and regeneration pathways. But most importantly, as you can see in this figure, those 15 minutes of incubation were enough to induce the regeneration of the corneal endothelial cells. In this picture, you can see these green, those cells that are actually proliferating in contrast to the cells that were not exposed to the growth factors. But then we decided also to determine the protective effect that this new treatment could have on corneal endothelial cells during surgery. And we know that oxidative stress is actually one of the relevant factors that affect the viability of the cells during surgery. So we did a very simple experiment. We incubated these corneal grafts with and without these plasma-rich in growth factors for just 15 minutes, simulating what we would do in surgery. And then both grafts were exposed to hydrogen peroxide, which is a potent oxidative agent, for 24 hours. So interestingly, as you can see here in the graph, the levels of annexin 5, which is an apoptotic marker, were significantly lower in those endothelial cells that had this brief exposure to the plasma before the oxidative insult. And this was actually confirmed also by immune staining. So in conclusion, these are the main three innovations in eye banking that we are developing nowadays. Number one, this dual chambered vial to improve the conditions for corneal graft preservation. Number two, these tissue engineered corneal endothelial grafts that in theory should alleviate the actual demand for corneal tissue worldwide. And finally, this plasma treatment for the regeneration and also protection of the corneal grafts. So to conclude, I just would like to thank our team, as they're actually the ones who really make all of these possible. Also to Bascom Palmer, to the Florida Alliance Eye Bank, and the Beauty of Sight Foundation for all their support. And thank you for your attention.
Thank you so much, Dr. Sabater. So we'll go right into the final poll question, which involves, of course, your presentation, and that is, innovations in eye banking are especially focused on, and there are your multiple choice selections, the audience. First one, retina. Second one, corneal epithelium, corneal endothelium, corneal stroma, or lens. Innovations in eye banking are especially focused on which one of these multiple choice selections? Dr. Sabater, let's see how all your colleagues do on this one. You gave a very thorough explanation. And then from there, we're going to move on to the Q&A. So 88% corneal endothelium.
That's right.
So they got it right. Great. Thank you so much. So let's move on to the Q&A, and we are going to begin with a question on how about augmented surgical performance for residents and faculty? Who wants to take this one?
I can take this one. We actually have a couple of different ways of doing this. You know, one is the 3D surgical platform. And, you know, one of the ones, for instance, with Alcon, there was a picture of me doing 3D cataract surgery there, is really helpful because it has almost like a heads-up display in a car, for instance, and an optical overlay where the, for instance, non-dilated pupil would be. So it helps with lens centration. And then you can also see other things on the screen too, and it helps to facilitate the surgery. So that's what we mean by augmented surgical technology. And then the other way to do it is sometimes when we're training, we actually have a machine called the Help Me See, which was a machine that was sort of, it's a simulator. It's a surgical simulator formed after the flight simulator too. and it gives you real-time feedback. So when you're making an incision, you actually have a little bit of resistance, just like when you're making a surgical incision. And that's how we're training our residents and fellows too. So two different ways to do that.
Thank you, Dr. Habash. This question comes from Mexico. A colleague in Mexico asks, please comment on the nano robot for the administering of medicine. Who wants to take this?
I think this might have come out of my talk too, but it wouldn't be a nano robot administering the medicines. The 3D prosthesis was made out of nanoparticles. And I think that might be what they're saying. That's the material that was used.
Okay. And this question is, what do you do to control the IOP? Which one of our expert providers wants to take that one? What do you do to control the IOP? Someone is muted. Dr. Cabot, there you are.
Yeah, so I think I mentioned it in the presentation. So for now, we don't have any way with our drone slit lamp to measure the IOP. Ideally, maybe in the future, we can have an air pulse device that can be mounted maybe on the slit lamp and can provide an IOP measurement. That's not the standard of care for sure, the air pulse tonometer, but that can be, an idea to work on in the future.
Okay. Here's a question that's interesting. How is gene therapy helping with COVID-19?
Yeah, so this is in the vaccine trials. In order to, imagine inserting a normal copy of a gene, and it takes the place of the disease gene from COVID. So now instead of having, the way, sorry, I'll backtrack just a second, but the way viruses multiply is they basically hijack a cell and then start proliferating copies of damaged cells. So it's the same exact theory. So when you can inject something that's a normal cell instead, it reroutes the virus so that it can't keep pumping out those damaged cells anymore.
Okay.
Sense.
And Dr. Sabater, can you answer this specific question? It's in Spanish. ¿Hay alguna experiencia utilizando hormona del crecimiento para favorecer a la reproducción de las células endoteliales?
Yeah, there are actually different types of growth factors that have been used to grow endothelial cells. I'm not 100% sure if growth hormone is something that has been tested, but I know, for example, that insulin or IGF, like insulin growth factor, EGF, FGF, like most of the growth factors have been studied to regenerate the corneal endothelium. But the main advantage of using a product like plasma is basically that you have not one, but several growth factors contained on the same product. So you're not only stimulating the cells with one single factor, but with multiple factors that would be really difficult to basically simulate by just introducing those factors individually.
Well, I think we've run out of time, certainly not out of questions and interest and wonderful presentations tonight. And we want to thank all of you in the audience for participating and hanging in from all over the world. We regret we didn't have time for everything, but the expert panelists were incredible as usual. That is why, of course, Bascom Palmer Eye Institute is #1 in America. And of course, we thank you because at the end of the day, we're here to care for your patients out there in the audience. And please visit bascompalmer.org to learn more about the topics covered tonight, or to uhealthinternational.com to refer your patients for virtual visits and in-person appointment with any of our experts. And kindly complete the survey at the end of this talk so that we can get some feedback from you, and you can even suggest topics for the future. We thank you for being with us from all over the globe. Have a great night, and please stay safe out there. Thank you to all our distinguished panelists tonight.
Thank you, everyone.
Thank you.
Thank you.